But in the context of flying, the important thing about flying is physiologically we were not developed to fly. What we are doing is defying our physiology with respect to getting on an aeroplane and going up at altitude. The sort of degree we do, and yes, the aeroplane is pressurised, but it's not completely pressurised. It's pressurised to a range where most people are okay. Most people is not kids, and the simple test of this is get on an aeroplane and listen to who's crying, listen to who is making noise and who's upset. It's the kids, it's the babies, and that's because those pressure changes as the plane takes off. And then also going down, that rapid change in pressure, the ears, specifically the Eustachian tubes, can't keep up with it. They can't equalise, and that pressure causes pain. And that pain makes them upset, and they grizzle and complain about it. So that's why babies cry on planes. And when it comes to kids in general with fluid, they're in the same boat. They're in a situation where for a period of time, they cannot equalise the pressures. So, is that a good idea to fly? Well, look, we're caught between a rock and a hard place because the honest answer is no. But then some people really just, they have to fly. They have to go home. And, I've certainly had situations where I've had kids who basically had to do emergency procedures because it was the only way we could, be certain and safe that the child could get on the plane and fly home without a certain risk. Now, the one risk in particular that we worry about, and it's extremely rare, but I have seen it. I've seen it once, and it's once too many when it happens to your child, is a complete 100% hearing loss. The ear goes completely deaf and the hearing never ever comes back. And this relates to damage from the inability to equalise in terms of the pressure it puts on the inner part of the ear. And there's a rupture of one of the membranes of the inner part of the ear, such that they get inner ear fluid leaking, and that then results in problems with regards to basically loss of that fluid, loss of the hearing. And when the hearing's gone, like I said, it doesn't come back. And that's a risk that is not worth taking in an ideal world. So in terms of the advice and so forth to be given, if there's middle ear fluid and plane flight is avoidable, it can be delayed, do so.